Hi, everybody. My name is Dr. Hanna. I want to welcome you back to MedPsych Health. We're doing a series on the truth about psychiatric medications in kids and teens. And today, I want to talk to you about overprescribing. It is my belief that more and more and more kids and teenagers are going on psychiatric medications than there needs to be. I believe there's an overprescribing of psychiatric medications, especially in the United States, where I'm most familiar. I've been in practice clinically as a child adolescent psychiatrist since 2002. So I'm kind of 18 years plus here in terms of prescribing. It is very clear to me that the number of kids, and not just in our area where I live and practice, which is outside the New York City area, but the number of kids who are going on medications increases every year. And there are a variety of reasons for this. And it concerns me. It concerns me greatly because it seems to me that we are looking to fix certain things with psychiatric medications that are not going to get fixed with psychiatric medications. There is this notion that if I take the right medicine, everything will be better, that my life will be better, my mood will be better, I'll be less anxious. The problem with that is that medications are intended to treat very specific things that are truly biological and truly have an underlying chemical problem identified. And the challenge with psychiatry is that as physicians, we are forced with symptoms. People come in to see us and they have certain symptoms. They're struggling in some way. And increasingly, there's a tremendous amount of pressure due to time constraints, cost constraints, and all sorts of reasons to write a prescription. And that pressure is felt from outside the physician, within the physician, and sometimes from patients themselves. The pressure to, I want to get well, I hate feeling this way. The problem is we're not addressing the underlying issues. We are putting kids on psychiatric medications in an attempt to make things better. The motivation is good, right? We want to help people. We want to help people to feel better. We don't like seeing kids being depressed and anxious or struggling with their behaviors. By the way, many medications are started for behavioral problems, right? For kids being oppositional, defiant, aggressive, irritable, without a clear understanding of what is being treated. Now, I am not against psychiatric medications, and I don't want you to misunderstand what I'm saying. I think there are certain kids who do need psychiatric medications, but I do think that number is a lot less than people realize. We are not addressing the underlying issues of culture, environment, parenting, expectations in terms of how kids are supposed to perform in school. This is especially challenging for me when we get into the conversation about ADHD, when we're talking about kids' abilities to focus and pay attention and the potential use of medications to help them to focus and pay attention. There's a certain expectation in certain areas, and it differs a lot of times socioeconomically. In the more affluent areas, the expectations about performance, and unfortunately in areas that are of lower socioeconomically, it's about managing behavior. We're putting children on medications to manage their behavior, to help them to be calm and quieter and easier. This concerns me tremendously. And the obvious reason is these medications have real side effects. These are not benign medications. Psychiatric medications have real side effects that are potentially very harmful. We're going to get into that in other videos in this series, but the main point I want to address today is there's an overprescribing of psychiatric medications in children and teenagers in the United States. We are attempting to treat things that are not going to get treated with medications, and that these medications have real side effects, and we need to step back a little bit and not fall pressure, either our own pressure to help, the pressure without from society, or the pressure from patients themselves. We need to own this. Our profession as child adolescent psychiatrists needs to own this. And we need to be very careful and think very carefully when we're putting kids and teenagers on psychiatric medications. So we're going to tackle some of these issues in other videos. And so stay tuned and please subscribe to our channel. And hopefully, if you like what you're seeing, you can provide us some feedback. And please feel free to share some of these videos. Thank you.